The Honourable Member for Rimbey Rocky Mountain House and the Leader of the Official Opposition.
Thank you, Madam Speaker. I have two sets of introductions today. My first is some constituents of mine from Rocky Mountain House, Laura Andres and Paul Andres, along with them some friends of ours from Red Deer, Brad Volkeman, Brenda Volkeman, and Heidi Volkeman, who do a tremendous amount of work with parent councils all across Alberta. That's how I know them. And I'm glad to see them here today visiting with us, and I would ask them to rise and receive the traditional warm welcome of this Assembly. And for my second set of introductions, Madam Speaker, I have a large group of people from Sundre and Mountain View County here today, including their worships Terry Leslie and Bruce Beattie. Terry Leslie is the mayor of Sundre and has been here many times. Bruce Beattie is the Reeve of Mountain View County, my home county. He's actually my councillor, Madam Speaker. I'd like to tell you whether I voted for him or not, but he keeps getting acclaimed, so I don't have to answer that question. Along with them are several councillors from Mountain View County and the town of Sundre, along with Dr. Eugene Landsbergen from Sundre, Teddy Tangay from the Nurse Practitioner Association, Jared Friesen from the Nurse Practitioner Association, Gerald Ingeveld, the chair of the Sundre Hospital community, and several citizens from the communities of Sundre and Mountain View County that are here today with Tammy Serby, who is a nurse practitioner in our community because of certain circumstances associated with the funding model, which we will talk about later today, will no longer be able to practice in our community, and is costing 350 patients not to have access to their nurse practitioner. And they're here today to show their support for Tammy and that important issue, so I would ask them all to stand and receive this traditional warm welcome to this Assembly.
Thank you, Honourable Member. The Honourable Member from Airdrie.
What if Alberta had an opportunity to dramatically improve the delivery of health care, especially in rural parts of the province, and achieve significant cost savings at the same time? Sounds crazy, right? The government has been telling Albertans for over 2 years that it simply can't be done. They argue that any attempt to reduce the amount of money we spend on health care in this province would result in deep, punishing cuts to frontline services. But what the government isn't telling Albertans is that they have had an effective, common-sense solution to improving access to high-quality health care right under their noses the whole time. The solution, Madam Speaker, lies with nurse practitioners. These highly trained healthcare professionals can perform many medical services to Albertans at a reasonable cost. And yet, despite the evidence and despite promises from this government to develop and implement a sustainable funding model for nurse practitioners so that taxpayers could save millions, we have seen no action. Madam Speaker, the community of Sundre provides us with a perfect example. The local nurse practitioners have approximately 350 patients that this particular nurse sees and treats on a regular basis. To date, she has been paid by local doctors who hire her to work out of their offices to assist with their large caseloads. But that funding model simply isn't sustainable. The doctors can no longer afford to pay her out of pocket for her work, and as a result, her 350 patients will now have to join long wait lists to see a doctor for the same service.
Shame.
This serves no one, Madam Speaker, not doctors, not nurse practitioners, and certainly not patients. And I can't for the life of me understand why, when faced with a golden opportunity to improve frontline services while simultaneously reducing costs, the NDP still refuses to act. It's yet another example of a government focused on ideology rather than what's best for the people it serves. It's yet another reason why Albertans are already shopping for a new government.
Leader of the Official Opposition.
It's Nurse Practitioner Week. Nurse practitioners provide high-quality, cost-effective services. They could play an important role in alleviating pressure on Alberta's healthcare system and help to improve rural health. Unfortunately, one of our visitors here today, Tammy Serby, has about 350 patients that will soon be without a nurse practitioner because the system doesn't fit practitioners within existing funding frameworks of rural healthcare delivery. Premier, do you recognize the importance of cost-effective role nurse practitioners play in rural areas? And will your government change the funding model to acknowledge the various types of healthcare professionals?
The Honourable Minister of Health.
Thank you very much, Madam Speaker. We are certainly working to make life better for Albertans by investing in healthcare and improving services that families count on. In Alberta right now, we have about 510 nurse practitioners that are a valuable part of that healthcare team. We are working to find ways to continue to expand their role in the system, and we certainly wouldn't be able to do that if we followed the advice of the Leader of the Official Opposition on cutting 20% from the budget, Madam Speaker. Instead, we're working with our healthcare professionals to find ways to expand scope and increase opportunities for them and all Albertans.
Right now, in many communities throughout rural Alberta, there are no doctors accepting new patients. Instead, there are wait lists just to have a doctor, let alone to see a doctor. This is unacceptable in a province that spends $59 million per day on healthcare. Recruiting and retaining doctors, nurses, and nurse practitioners is a never-ending battle in rural Alberta. It's not that many medical professionals don't want to live in these rural areas, it's that they keep having to overcome political red tape when what they should be able to do is focus on taking care of their patients. Premier, what is your government doing to address their frustrations and ensure Alberta, rural Alberta, get efficient and effective health care?
Thank you again, Madam Speaker. I was proud this morning to be at AAMDC and have meetings with a number of folks. And we know that attracting and retaining healthcare professionals is an important priority for this government and one that we take very seriously. We've been able to revisit the RPAP program, I think, with great effect. And just this morning, I met with folks from Fairview area and Worsley and was happy to make sure that we informed them that we've been able to secure a new doctor who is a Canadian-trained medical graduate who will be starting there this summer, Madam Speaker. And we'll continue to make sure that that happens in all parts of the province, that we get the best care in the best place, Madam Speaker.
Ms. Serby has lived in the community of Sundre for decades, and she wants to stay there. But her employment as a nurse practitioner in her community won't last much longer. Just to maintain her license, she would need to commute to Calgary or Red Deer to practice. All the while, people in her local rural community need her services. It's outrageous, Madam Speaker, and it makes no sense. There are people in our gallery today and hundreds of people in Mountain View County that are about to lose access to their practitioner. Premier, will you work with your minister to solve the problems with the funding model that are affecting people like Ms. Serby and her patients and get nurse practitioners working all across rural Alberta?
Minister of Health.
Thank you again, Madam Speaker. I'd be certainly happy to meet with the constituent of yours, honourable member, and to have an opportunity to discuss this. We do work with our primary care networks on a model that gives them $62 per patient per year to ensure that they have the wraparound services for all their patients. I'm proud that primary care networks have stepped up to work on a new governance framework, but we definitely are giving those resources to the folks that are closest to the ground to make the best decisions for their communities. But again, I'd be very happy to meet with this constituent and have a conversation. But we do entrust that the local primary care networks use those resources as best possible, Madam Speaker.